Welcome to part 2 in our two-part series on mallet finger injuries. In part 1, Flex.Physio director Ian Dowley covered the basics of mallet finger injuries, what they are, how they happen, and what sort of surgery and treatment options may be required. In this second video, Ian will take you through splinting options and the recovery process for your mallet finger injury.
What sort of splint should you use for your mallet finger? It's a great question. There are many options available. Your local pharmacy may have some off-the-shelf splints that are designed for mallet finger injuries. Some people make it themselves at home. There are lots of DIY options. At Flex Physiotherapy, we make custom-made thermoplastic splints which are molded to the individual injured finger. We like these because they fit well, they're waterproof, they're adjustable, remoldable, and they're easy for the patient to get on and off for skincare. We can teach the patient how to do that without allowing the fingertip to bend. Of course, not everyone can get to Flex Physiotherapy to have a custom-made splint fitted, but there are a few key criteria that you should look for when choosing your mallet finger splint. First, the splint needs to be effective. It needs to actually do the job of getting the fingertip straight and keeping it straight. If your fingertip is resting in a bent position inside the splint, then it may never heal. Second, the splint needs to be comfortable. If you get an off-the-shelf splint, which is a bit too small, it can cut in and be too tight and irritate the skin. Or if you use a makeshift splint, which is taped on, then the adhesive tape can irritate the skin either from an allergic reaction or just from the repeated removing and replacing of the tape. And third, the splint should be user-friendly. You want the splint to be easy to take off when you're washing and drying the skin, and easy to get back on again without the fingertip bending and buckling in the process. So how do you get the splint on and off safely? It's quite important that you do so. If you're wearing a splint on your finger 24/7, then you can get sweat and moisture trapped against the skin, and eventually that can be very unhealthy for the skin. Anytime it gets significantly wet, you want to be able to take the splint off, wash, dry and air out the skin before you put the splint back on again. You will need to develop and practice some good habits, some good techniques for getting the splint off and back on again safely, never allowing your fingertip to be unsupported or to droop. In the description below this video, you'll see a link to another video we've made which shows how you can get a mallet finger splint off your finger and back on again while keeping the fingertip safe. What about getting your finger moving again? Well done, you've successfully made it through 6 weeks or 8 weeks of wearing the splint full time. What now? The recovery process from here on is a balancing act between 3 possible bad outcomes: a re-injury, stiffness of your DIP joint, or an extensor lag. Let's consider each of those 3 options. First, re-injury. After 6 or 8 weeks, the bone or tendon that is healing is getting strong, but it's not at full strength yet, and re-injury is certainly still a risk. To minimize the risk, your splint should still be used on a part-time basis for at least another 2 weeks. This would include at night time when you're sleeping, when you're in crowded situations, when you're doing heavy gripping activities, and of course in any sort of sporting environments. Ball sports like football or basketball are often best managed with a splint taped onto the finger securely rather than just depending on a Velcro strap. The second risk is the risk of stiffness in the DIP joint, the end knuckle. Any joint that is immobilized for a long period runs the risk of becoming stiff. This risk increases as we get older or if there is underlying arthritis in the joint. Minimizing this risk is one of the reasons that we get the splint off around 6 to 8 weeks rather than leaving the splint on for months and months. We do recommend starting some gentle active exercises, gently bending the DIP joint, just using your muscle power, not putting any external force through it from that 6 to 8 week stage. While you're doing these gentle exercises, you should never be feeling more than a little bit of stiffness or a little bit of discomfort. There's never any reason to push through pain to try to get your DIP joint moving again. If stiffness in the DIP joint still persists, a further 6 to 8 weeks after the splint comes off, you might at that stage consider using the other hand to do some gentle stretches for the DIP joint like this. The third problem is a DIP joint lag or an extensor lag. This is quite a common problem after a mallet finger injury, especially when it's a tendon injury. An extensor lag is the name we give to a finger that can bend and can lift part way, but can't quite lift all the way back to that fully straight position that it could before the injury. This doesn't indicate that the tendon has failed to heal. In fact, what it means is that the tendon has healed, but in a slightly longer and stretched out position compared to before the injury. A small lag of 10 or 15 degrees is very common and usually causes no functional problems for the patient. But if a lag is 20 degrees or more, it can be very awkward. This is why we are so gentle with the exercises that we prescribe after a mallet finger injury. We don't want to overstretch the healing tendon and encourage a bigger lag. If you start to notice a lag developing or increasing as you get your finger moving, take a little backward step in your rehabilitation. Use your splint a little bit more and be a bit more gentle with your exercises. Getting a mallet finger injury fully healed and back to normal can be a long, sometimes tedious, sometimes frustrating process. However, it's worth it. It's worth taking the time in the splint to allow the bone or tendon to heal fully, and taking your time with gentle exercise and gentle movement so that you don't develop a lag. Thanks for watching. Please share this video with anyone you think might be interested. And don't forget to click the subscribe button so you don't miss out on any of our other videos. See you next time.